Good morning, Celebrate Life. We are here in February, the month of February, and with it being the Love Month, the Heart Month, I decided to ask Dr. Veronica Jones if she would come on in and share a little bit about heart and cancer with us today. So, welcome, Dr. Veronica.
Thank you. Thank you. It's really an honor to be here with you all this morning. I am, my name is Veronica Jones. I am a breast surgeon at City of Hope, and I've been at City of Hope for about 7.5 years now. Prior to that, I was on faculty at Emory in Atlanta, Georgia. And that's where I also did my fellowship in breast surgical oncology. Prior to that, I was in Dallas doing general surgery. I went to Meharry Medical School. And before that, I went to Stanford for undergrad. And I'm from South LA. So I grew up kind of Crenshaw district across the street from the mall. Mom and dad still live over there. And I currently live in Pasadena with my husband and my 4 kids, the youngest of which you might have seen earlier on the call. And my husband's a pastor. So that's all about me and my life. So Pastor Rhonda asked me to just speak with you all a little bit about cancer and the heart. And so I can speak to you all about that from two different focuses, lenses rather. One is cancer and your actual heart, right? Because there is a lot coming out in cancer and heart health. I actually do some research on that, so I'll share a little bit about that with you all this morning. So you get to hear some of my research and how cancer does affect the heart, but then also heart from an emotional standpoint, of course, and how cancer affects that. So if you guys have any questions, of course, please let me know as I'm talking. I'm really informal. I love talking to people and I love educating people. So if there's something you do not understand or you're like, hold up, I need to hear a little bit more about that, please feel free to interrupt me and let me know. So first, about cancer and the actual heart, like your heart organ. We know that the therapies that we do give for to treat cancer can definitely impact the heart, and unfortunately, disproportionately so in Black and African American women. So the medications that we give to treat breast cancer in specific do affect your heart function and your heart health. So the chemotherapy drugs that we give, like adriamycin, if any of you have had that, that's referred to as the red devil drug by a lot of patients, that does impact your heart, so much so that before you start that treatment, typically your medical oncologist will ultrasound of your heart called echocardiogram, just to make sure that it's functioning well enough. If you have another type of breast cancer that is HER2 positive. So if I'm speaking a foreign language to some of you, I apologize. For those of you who have ever had breast cancer, is everybody on the call a survivor, Pastor Rhonda?
Or I don't think so. Majority are, though.
Majority, okay. So if your breast cancer was HER2 positive, which is a type of breast cancer, then you receive some other drugs that are specific for that type of breast cancer. And those also impact your, again, so much so that they have to check to make sure your heart is even healthy enough to have the medication. And then after you go through treatment, of course, we put stress on your body with all the medications we give, with the surgeries that we do, with the radiation that we give. Radiation can impact your heart, especially if the cancer is on the left side. When they give the radiation, it can impact the heart. We really try, radiation oncologists really try to avoid the heart as much as possible. But even still, sometimes your heart gets a little bit of that radiation and it can cause scarring in the blood vessels of your heart. And so there are a lot of things that we do to impact the heart. And, you know, Black and African American women have a disproportionately high incidence of heart disease anyway. And then in my research, I showed that Black women actually have a much higher risk of death from heart disease after being treated for breast cancer. So not the breast cancer itself, but actual heart disease. And right now I'm looking into why that is. And, you know, if it's because of higher heart incidents, like heart attacks, stroke, things like that, or if it's the drugs, or if it's a combination of both. So research is still being done to figure out why heart disease is higher in Black women because of the chemotherapies we give, because of the treatments that we give. So I know that was a lot of bad news. I do have some good news. The good news is that, one, that we're doing research in it, right? So we are trying to figure out, and at least we're aware. So this is a big pet peeve is not the word, but a big issue of mine with treatment in general, cancer treatment, the medical field. A lot of the treatments that were designed were not designed with diversity in mind, right? So these drugs were developed in a very homogeneous population, mostly white men. And then for breast cancer specific drugs, white women, and they don't necessarily apply to all the beautiful, you know, diversity of women and men that get. And so right now we're seeing, okay, maybe these drugs that we thought were good aren't as good in certain populations. And so a lot of research right now is being done on, okay, let's back up. Let's see, okay, do these drugs work in other people? And if not, how can we make better drugs that work and don't have all the side effects that these other drugs have in different populations? So that's one good news, is that there's a lot more awareness and a lot more researchers themselves who are doing the work to address the problem. And then another thing is, a lot of work has been done in restoring that heart health, right? So I have some colleagues who are looking at how the cancer treatments that we give speed up aging process, speed up just deterioration of your body, and then looking at ways to fight that. So whether it's an exercise regimen or massage or rest or changing the drugs or more support, or lessening the amount of the drug that we give while still maintaining the treatment efficacy. A lot of people are looking into this and coming up with strategies to mitigate or make sure that the drugs that we're giving are not doing as much harm as they had in the past. We're also getting it so that patients, even before they have treatment, are as healthy as possible, right? So making sure that we get all the other conditions under control. And then in the survivorship period, just watching out for any signs that there is damage to the heart or worsening of all the conditions that can impact the heart, like diabetes, or hypertension, you know, high blood pressure, high cholesterol. Medications that we give can worsen your, you know, make your weight go up. They can cause diabetes, which all impact your heart. And so we are doing a lot of things to give medications in the survivorship period. So after you've already been treated and you're thriving or surviving, wherever state you're in, emotionally and physically, we're doing things at that space to make sure that we're addressing the problems that these drugs are causing. Like we know that they're causing. You might be wondering, okay, why are you giving them if you know that they cause all these things? Great question. We still think that the benefit outweighs the risk in certain people, and so still important to take those medications if your healthcare provider has prescribed them for you. But if you do notice anything, I guess my plea is to not ignore it. We know that these drugs cause heart issues. So if you notice any change in your health, like you can't seem to lose weight. That's a side effect of tamoxifen, anastrozole, letrozole, these very common medications. If you notice that, talk to your doctor about it. If you notice your heart skips a beat sometimes, talk to your doctor. If you notice that your blood sugars are not as under control, or going to the bathroom, tell your doctor, because these can all be signs of things that we know these drugs can cause. So one, it's not in your head. Two, if your provider doesn't listen, consider talking to somebody else, because these are side effects and they can impact your heart. I will pause there. I know that was a lot, and I want to see if anybody wants to talk about any of those issues in more detail, or have any questions based off of what I just said. No.
It seems like we're good.
Okay. All right. Is that in line with what you wanted to know about cancer in the heart?
Is because I know I happen to be one of those who has developed cardiomyopathy.
Mm.
And so it's just a matter of now what do I do? Do I really have to take this medicine for the rest of my life? Could it have really have been as a result of the care that I received that saved my life? And then, is there anything else other than just taking medicine that I could be doing?
Yeah. Yeah, those are great questions. Most likely it does come from the treatment, right? The treatment saves your life, but it can cause these other side effects like cardiomyopathy. And so that's a real known side effect. A lot of times what we'll do is figure out if it's from medication that you're actively taking, or if it's a side effect from medication that you previously took, right? So that would be the first step if anybody does get diagnosed with a heart condition, is to find out if it's something that is actively being caused or just a side effect from something in the past. Because if it's from something that you're taking right now, you should stop the medication. I mean, you stop that medication and you look for alternatives, because typically with any drug that you're on, there is an alternative. So if you're on like one of those drugs that I mentioned, like tamoxifen or anastrozole, letrozole, there are alternatives. If you're on like Herceptin, Perjeta, these are drugs for those HER2 cancer. There are alternatives. So just if it's caused by something that you're actively on, then of course we stop that. And then it's also correcting anything else that could be impacting your heart, like I was saying. And I don't know your personal story, Pastor Rhonda, so I'm speaking generically now. If there is anything else like diabetes, high blood pressure, high cholesterol, weight management concerns, things like that, then to address all of those issues as well. And that typically will take some of the stress off of the heart so that it can function better. So when you take care of all those other things, typically the heart is healthier in general. So that's just something to be mindful of, that even if a medication from the past caused the heart issue, if you address like some other concerns, your heart has the room to be healthier. I saw a chat come up really fast, but I couldn't see it. Is anybody able to? Pastor Ron, are you able to read it?
It says needs, nutrition, exercise, decrease. Okay, I don't know what ETOH is. Don't smoke.
Oh. And smoking, is it you saying needs to
Kimberly,
address?
would you like to tell us? Okay, so I don't know that I understood it completely. But to be able to speak to nutrition, I was trying to see if those letters lined up with the word needs. Nutrition, I guess these things are important. Oh, her mic is not working properly.
Yeah.
Nutrition, exercise, decrease, and then don't smoke. Um,
Yeah. So of course, yeah, of course, those things. We recommend a low fat diet for breast cancer survivors. So there is evidence diet over, of course, versus diet better in terms of decreasing and also or helps you fight cancer better. So a low fat diet, which we heart healthy diet, and then for eyes, the recommended amount is 30 per day. So that's a lot. So I was saying that exercise of about 150 minutes per week. So 30 minutes per day, 5 days a week of moderate intensity exercise, or 75 minutes of high intensity exercise are what's recommended in the survivorship period to help prevent cancer from coming back. Weight management is considered protective. This is both for your heart and also to prevent cancer from coming back. So if you maintain your weight or lose weight if you ever were overweight, then it can decrease your risk of breast cancer coming back by 50%, and as opposed to like gaining weight in the survivorship period. And it also, of course, protects your heart. And then alcohol consumption, yes, definitely great for heart health. For breast cancer recurrence, and specifically, it's not 100% necessary to avoid all alcohol. So I often tell my patients, I'm like, you can have a glass of wine, that's fine. Like it's not going to cause the cancer to come back. Like it doesn't. In studies that look at alcohol, it's like a lot of consumption of alcohol that increases your risk of cancer, and of course worsens your heart health. Absolutely. But a glass of wine a day is not bad. And then for smoking, I know you're hearing it straight from me, breast cancer surgeon. It is okay. I tell my patients, because they're like, oh, that means, once they're diagnosed, they're like, oh, I gotta stop all sugar, all alcohol, all red meat. I'm like, you gotta live. I mean, you don't have to cut out all that stuff. There's no science to say that you have to cut all that stuff out, right? I think we in general put a lot on ourselves burdens that we weren't meant to carry. That is not one that you're meant to carry if you do enjoy a glass of wine occasionally. So that's fine. You don't have to cut it out completely. And smoking, though, yeah, you do have to cut that out completely, right? That does worsen your heart. That worsens your risk of cancer coming back and multiple cancers. So smoking, I can't justify even in moderation, but yeah.
all right. Now, there are some survivors on the line that are not breast cancer. Would this information be consistent across a lot of the chemo treatments or whatever, radiation?
Yeah, so it actually depends. For the chemotherapy, different drugs have different, what we call cardiotoxicities, which is how much they impact the heart health. Not every breast cancer chemotherapy drug, this is bothering me, the light, I'm so sorry. Hold on one second. That's worse. Anyway, so not every chemotherapy drug for breast cancer even impacts the heart. So it's only some. And then for other, chemotherapies for other organ systems, it just kind of depends on the drug. Same for the radiation. Radiation is very targeted. So radiation will impact your heart if your breast cancer was on the left side, but not if it was on the right side. Not typically, unless the breast cancer was like toward the inner part of your right side. But if it was on the outside of your right breast, that radiation does not impact your heart. Same with other body parts, like if you had pelvic radiation or like leg extremity radiation, even head and neck cancer, does not impact your heart because radiation is a very local therapy. So it's mainly for patients who had breast cancer on the left side.
Okay. So I know you only have a few more minutes. So did you want to talk about the spiritual heart?
Yes. Sorry. I'm
You're
so
good. You're good to us. Oh,
oh,
that's
okay.
better.
It was in my eyes. It was really bright. So the spirit, I mean, yes. So I kind of feel like that is easier and harder to talk about, right? Because everybody's experience is so different and everybody's at a different stage in either the process of treatment or the process of healing, right? Which are two very different things. And so if I could just say to everyone to have grace for yourself, whatever stage you're in, like it's a process. I know that treatment is long and I know the survivorship period is longer. And so just to whatever phase you're in, to have grace for yourself. And that's why whenever I talk to a group, I do try to lighten some of that load in terms of I have to do this, I have to do that, I have to be perfect to get the outcome that I desire. And so I know it's probably easier said than done and hard to hear, but you do not have to be perfect, right? There is so much grace in all of this in terms of how you go through the survivorship period. And so if you could hear it from whatever bucket you want to put me in, a breast surgeon, a pastor's wife, like have grace for yourself. And you all have this group, which is amazing. I'm sorry I can't be here for too long. I got, we have family stuff that we have to go do, but I wanted to at least show my face because I just adore Pastor Rhonda, first of all. And then I just love this group. So if you stay connected to this group, I think that you're in good shape because you have a support system. And the hardest times I have in clinic are with patients who don't have a support system at whatever phase they're in, whether they're in active treatment or if they are, 10 years out, because I see my patients for years and years and years. Whenever they don't have a support system, that's when stuff gets hardest. And so be kind to yourself. I know that's really generic, but if I really mean it. Have the glass of wine. I told one of my patients to eat some monkey bread for Christmas. I mean, I just, it's like, and don't go crazy. Don't eat the whole pan, but it's like, let yourself feel for a little bit, whether that's sadness because you have a loss or happiness because you got to eat some monkey bread. Like let yourself feel and let God meet you in that space, whatever it is. So just have grace in yourself. Don't make yourself have to be perfect. And I think that leads to emotional, spiritual heart health. Anyway, that's my 2 cents on it.
And amen. And thank you for that, Dr. Veronica. It's been great to have you once again, and you will be back. In fact, we have Celebrate Life has a YouTube channel, and it's Celebrate Life Today with Pastor Rhonda. And so we need to go on there where we can have a detailed conversation on actually to do both of these. That would be really, really good.
I would love that.